Hi everyone, welcome back to my channel. So today's video is going to go with the series of what my symptoms feel like. And I'm going to continue with the muscle stiffness. This time I'm going to be talking about the muscle stiffness in my pelvic floor. So I just want to give you guys a heads up at the beginning of this video. It is not suitable for work. It's going to be a bit explicit. If you are uncomfortable with discussions of private areas and genitals and all of that, then I highly recommend that you skip this one. It's kind of tough for me to talk about as well, but there's got to be other people out there with symptoms like this. I know that there are a lot of women that suffer with pelvic pain. I imagine there's got to be someone else out there that's having, these symptoms as a result of some kind of autoimmune illness. I don't think I am the only one. And if this video is going to help anybody, even just one person, then it's worth the embarrassment. So this was actually, I think, the very first symptom that I had many, many years ago. I was still in college. I was in my final year at the university. And I began to have this symptom. I was actually doing an internship at a casting agency or something, and I was doing a lot of sitting, so you'll see why that matters in a little bit. I was sitting a lot. I was sitting in traffic for like over an hour to go to this job where I was going to be sitting for, I think, like 7 hours, not getting paid anything. And I was there, I think, Tuesdays and Thursdays or something like that, or Monday, Wednesday, Friday. I don't know. I was there a couple times a week, and I really dreaded those days because I knew I was going to be stuck in my car, then stuck in the office, and then stuck back in my car. It was literally my entire day. And I'm out here in Los Angeles, so obviously that's LA traffic. So I started feeling like I had been sitting way too much. So like if you've ever gone for like a long trip in a car, and you start getting that feeling of like soreness in your butt, like I've been sitting a lot, kind of like on the bones. It almost feels like you're sitting just on your bones sometimes. And, without really realizing it, I think I had also been losing weight at the time. And so I blamed it on the fact that I was thinner and that I was just sitting on bone. I had no fat to cushion my butt with. And so to me, I was like, you know what? I'm sitting for probably over 10 hours a day without getting up. And, I'm really thin. And, that's just, you know, that's what the problem is. I mean, there was no way for me to tell that this was something else. This was something entirely different. As it continued to evolve, so if you did watch my other video of my muscle stiffness in my trunk, it was a very, very similar trajectory. And actually, this symptom came before the muscle stiffness in the trunk. So by the time I started having the stiffness in the trunk many years later, I kind of already, I recognized the trajectory, the evolution of the symptoms. So again, it was something that began and took several weeks to unfold, somewhere around like 6 weeks. And at first it felt like I had been sitting too much and I was sore. Then it started feeling like I had something stuck in my rectum, if that makes, if you can even imagine that. It felt almost like a ball, or I describe it as a golf ball in the rectum. And obviously, if you kind of try to imagine it, think about having something stuck in your rectum and then you sitting on it. And I guess logically it would, it shouldn't really hurt, I guess. But it hurt like hell. This symptom is probably by far the most painful symptom that I've had throughout my entire illness. I have had menstrual cramps that were very, very painful, and I actually think they're related to the muscle stiffness. So it's kind of goes hand in hand. But this was an incredibly, incredibly painful symptom. And especially because I had to sit for so many hours. I was sitting, the days that I did the internship, I was sitting for well over 10 hours a day. But then the other days I had classes to go to. And, sometimes you have lecture classes, which are like 3 hours long. And it was just horrible pain. And it was made worse by sitting. So it felt like a golf ball. And it hurt more when I was sitting, and it also felt like nerve pain. So shooting nerve pain going from the rectal area across the like your glutes, across your butt. Almost like, I kind of think of it as like whiskers going out that way. It was just horrible, horrible pain. I also started noticing difficulty passing stool. This would become my new normal up until today. So it's been almost 17 years, I think. I would only be able to go to the bathroom in the morning. It didn't matter if I had to go even more. And whatever I went in the morning was all that I was going to go the rest of the day, because the muscles would tighten up so much that I wouldn't be able to pass anything for the rest of the day. So if I didn't go in the morning, I was very uncomfortable the rest of the day. The other thing that I noticed as the years went on, this was, like I said, this was like the very, very beginning of these symptoms. As the years went on, as I graduated from college and I started working as a substitute teacher, one thing that I noticed was that the earlier I would get up, the harder it was for me to go to the bathroom as well. So it's almost like there's this sweet spot. Like I had to wake up naturally and be relaxed. And I would wake up, I would have to eat breakfast, and then a little while later, I would go to the bathroom. And that was it. And of course, as I mentioned with my other video of my muscle stiffness in my trunk, there were other issues as well, like diet and things like that, that would also affect, the constipation. And we'll kind of get to that in a little bit. So this was horrible, horrible pain. I was already, I think, in my second semester of my senior year. So I was almost done. I wanted to drop out of school, or I wanted to take a break because I was in so much pain. But obviously, my family wasn't really going to believe me. I went to the doctors and they told me it was like hemorrhoids, which I was like, wow, hemorrhoids are really incredibly painful. Hemorrhoids do not cause pain, by the way. That's something that I recently learned. Hemorrhoids do not cause pain. Fissures do, but hemorrhoids do not. They will cause bleeding, but you don't feel them because they're inside. So they checked me out. They said, you don't have anything. I told the doctor, I said, I'm in a lot of pain. I don't know what this is. It hurts really bad when I sit down. And they just kind of look at you like, whatever. So I don't know which doctor it was, but there was one doctor that prescribed me ibuprofen and nerve medication, because I guess the way that I described the pain, it sounded like nerve pain. So they gave me ibuprofen and nerve medication. I took the ibuprofen, and that minimized that feeling of a golf ball in the rectum. So I guess it was some kind of swelling or something, and the ibuprofen brought that down. And the nerve pain kind of, it was blunted by the medication, by the nerve medication, but I could still it still felt like I was sitting on something. So it wasn't as sharply painful. It was still painful. And the golf ball felt smaller, but there was still something there. It still felt like I was sitting on something. And of course, your mind goes crazy thinking I have a tumor, I have, rectal cancer, because you don't know what it is. And again, cancer, I don't think you really feel cancer until it's like very advanced. And I had already gotten that checked out, and the doctors were like, there's nothing there. So over the years, so my senior year, this was my senior year in college. And by some, sometimes I say that it's like, these are miracles. I know I'm not like incredibly religious, and I know some people will hear this and be like, what does that have to do with it? But I always kind of felt like throughout this entire journey of my illness, there have been people that have been put into my path And you'll see that also in my acne video, that there's always someone that comes into my life at just the right time, and they somehow are able to help me. And at the time, I think after the internship, I eventually left that internship. I think it was only a few weeks long, and I was able to get a job on campus. And my boss had interstitial cystitis, which is, it's like a bladder condition where you have like cysts inside your bladder, and it causes a lot of pelvic pain. And she had to go to physical therapy regularly. She would go to a pelvic floor physical therapist, which I didn't even know existed at the time. And she said, "This lady has helped me with my pain tremendously." She said, "I think you should go and see her." And I did. And this kind of physical therapy, it is a real type of physical therapy. I know a lot of people are going to be maybe weirded out by it. I know my mom was. But for women, essentially, the pelvic floor is, down here in your pelvis, and it can be accessed vaginally and rectally. And what the physical therapist does is they go in through, the vagina or the rectum, and they palpate the muscles, and they kind of push on them, and that's how they stretch them out. And I remember going to my first, and keep in mind, I know this is going to be TMI. I was not sexually active at the time. I had never been sexually active. So I had no idea what this was going to feel like. I was only aware of the rectal pain. I did not like, I could not sort of map it out in my mind. I couldn't map out the muscles and how far the pain was going to go. And I went to this pelvic floor therapist, and I described the pain, and I could tell that from describing it, that it was pretty severe pain. And so she didn't even bother. She said, I just want you to, lay back. She said, "I'm going to grab a pencil." So she grabbed like a pencil or like a pen or something. She says, "I'm going to push the exterior." So she wasn't going to go in vaginally or rectally. She was going to push around like the groin area. She says, "I'm going to touch with this pen or with the pencil, whatever, with the soft part, the eraser part. And I'm going to push gently, and you tell me what it feels like in every area that I'm pushing." And in some of those areas that she pushed, it felt bruised. It felt like I had gotten beaten up. It felt like bruising and very tender. And she was putting, a little bit of pressure. And she kind of just looked at me, and she was like, "All right." She says, I'm going to use my pinky finger, and I'm going to go in. I think she went in vaginally. And she said after she did that, she said, "I could barely fit my pinky finger." And that was vaginally. That wasn't even in the worst area, which was rectally. So come to find out, I'm one of the worst patients that she has ever had. I'm one of the most severe patients that she has ever had in her practice. And it took, I think, well over a year of physical therapy, starting very slowly, with, I don't know if it was her pinky finger or her pointer finger, and eventually her working those muscles out. And let me tell you, it is horrible, horrible pain. I was sore. I was, and to have pain in such a delicate area is just horrific. And I couldn't really talk to anybody about it. My mom didn't want to hear it. That's not something that she's comfortable talking about. And who else was I going to tell? This is a very, very intimate matter, and it's, you can't really talk to anybody about it. But it took a while, and my symptoms did improve, although they did not completely resolve. So that was one of the things that helped. PT, the ibuprofen seemed to help. Not sitting as much. So in the future, when I got a different job, I took a standing desk. I took a job as a substitute teacher so that I could stand and sit whenever I wanted to. That helped. And I think diet also helped as well, because once, I was having a lot of difficulty, I noticed now looking back, even though I had gone through PT, even though we had loosened those muscles and gotten the muscles to a much better place, um, I was still dealing with constipation, not being able to pass enough stool. Because I mean, when you look at your own bowel movements and you look at the amount of food that you're eating throughout the day, you're just like, there's no way that I'm eating this much and going that little. And eventually, I think I removed dairy. That was one of the first things I removed from my diet, and I noticed I was able to go a lot easier. And then eventually, once I got to my Lyme doctor many years later, probably close to 7 years later, we did a complete overhaul of my diet, and I was able to go even more. And she said that that was something that was very essential. She says, you need to be evacuating as best as you can. You have to get all that stuff out, because that can also cause, more issues. And then, of course, IVIG. So I did talk about the IVIG with my rib cage. And now I'm going to talk about the IVIG with the pelvic floor. And again, it's very, very similar reaction, very similar response. When I did the IVIG the first time, so my first go round of IVIG back in 2013, I described how my muscles in my rib cage responded. They started kind of freaking out and twitching and doing all this kind of stuff. The same thing, something similar happened with my pelvic floor, except that for whatever reason, the pelvic floor, and I'm also affected on my left side. So in both of these areas, my stiffness is asymmetrical. So on my rib cage, it's on my right side. On my pelvic floor, it's on my left side. I'm worse on my left than I am on my right. But I think because the muscles are smaller and there's probably less nerves that are affected, I don't experience the fasciculation, which is the twitching that's sort of like ants running across your skin type of sensation. But I did feel the muscles just kind of like scoop up, almost like a parachute kind of going up and down. And when they moved, and I think that when I had my first infusion, I think it was like in the afternoon, the nurse came and was administering the medication. And I went to my room to lay down because you get sleepy from the Benadryl. You have to take Benadryl, and the medication just makes you sleepy. And I started feeling the muscle twitching in my rib cage, and then feeling my pelvic floor muscles kind of like moving. And then immediately I needed to go to the bathroom. So it's almost like they kind of relaxed or they loosened up, and I was able to go, which was unheard of. I couldn't go to the bathroom in the afternoon. It was only in the morning. So right then and there, again, I knew that we were onto something with this medication. And, my doctor describes it as, it's an anti-inflammatory. It's, going to reduce inflammation. At the time, again, I did not know about SPS. And as a matter of fact, SPS is it can affect trunk muscles. It typically affects arms and legs, but there's not really pelvic floor muscles are not really muscles that are affected by stiff person syndrome, from what I have researched and from other people that I've been able to communicate with through Facebook groups. The pelvic floor is not really one of the muscle groups that is affected by SPS. But again, SPS doesn't have really a typical patient. So the fact that the muscles responded to IVIG tells me that it's probably stiff person syndrome or some kind of inflammatory illness or an autoimmune illness. Again, the muscles did not stay in that relaxed state. They went back to their sort of stiffened state, and then little by little, they improved over the year that I was on IVIG. And again, they sort of reach a certain point where, that's about as good as they're going to get. And I'm just happy with it. I'm not in as much pain sitting down as I used to be. But it took all of these things to get me to a much better place. So that is my pelvic floor muscle stiffness. This video's gone pretty long. I didn't think it was going to go this long. But that's my pelvic floor muscle stiffness. Please like and subscribe. Turn on your notifications if you want to continue to watch this series. I will have more symptoms, coming up, and I will add these to the symptom playlist as well. Leave any comments below if you have any questions. I know that this is a very sensitive matter, especially for us ladies, but it is horrific. And my heart goes out to anybody that suffers with this kind of pain, and pelvic pain also affects men as well. And I know this because I did go to a pelvic pain clinic. Oh, that's another thing. The other thing that helped was paradoxical relaxation. And I believe I have a video on that in my treatments playlist. I did go to Santa Rosa and I saw a psychologist who has, he does this like 3-step protocol for pelvic pain. It's physical therapy, relaxation techniques, and all of that. And I met a lot of people with pelvic pain, both male and female, at this clinic. It was 10 days, but it did help tremendously, and it actually helped my stress and all of that as well. So that's another thing too, is just, it's a pelvic pain clinic in Santa Rosa. But let me know if you have any questions. I'm not very shy about this stuff anymore because I've been dealing with it for so many years. And like I said, like and subscribe and stay tuned for more videos. So I'll see you guys in the next one. Take care.